Today we will discuss the development of heart. Here we can see an embryo of 18 days which has a head and a tail. There is a cardiogenic area. This cardiogenic area in the embryo is responsible for the development of a complete heart, and this heart will be formed approximately by 4 weeks of development. First of all, what happens is this cardiogenic area develops into two endocardial tubes. These endocardial tubes, as we can see, there is a blood flow that has been shown. That means the blood flow through these tubes has already started by this time. Now what happens is these two endocardial tubes will fuse to form a primitive heart tube, and this primitive heart tube will be developed into the complete heart with all its chambers. Now we will see how this tube develops into a complete heart with all the chambers and the structures. First of all, we can see that at around 20 to 22 days of development, these are the four structures that will develop from this in this primitive heart tube. First structure is the truncus arteriosus. This is the truncus arteriosus. Then this structure is the bulbus cordis. This is the primitive ventricle, and then primitive atrium. This structures, all these structures will develop into the ventricles and the atria. As the name indicates, the ventricles will develop from the primitive ventricle, and the atria will develop from the primitive atrium. Now first of all, we'll see this truncus arteriosus here is going to these arrows. What are these arrows showing? This heart tube, of course, is going to convert into all these ventricles, so it rotates in a certain fashion, as we can see in this arrow. This rotation is the main thing that is going to form this heart from this tube. Okay, so this rotation there are different angles of rotation and all the details that we are not going to discuss here, and there can be certain pathologies also due to this malrotation, but for now we only need to know that this rotation will lead to this a complete heart formation. This rotation is going to take place about 23rd days of development. Okay, this bulbus cordis arteriosus and this bulbus cordis, they are going to contribute to the outflow tract of the heart. The truncus arteriosus and the bulbus cordis are going to develop the outflow tract. Now what is the outflow tract? We know that outflow of the heart is going to be from the ventricles, right? Ventricle, the right ventricle and the left ventricle. As we know that left ventricle is going to give rise to the aorta, and the right ventricle is going to give rise to the pulmonary trunk, right? Now these two structures, as we can see, this truncus arteriosus and the bulbus cordis. This bulbus cordis, as we can see, this is near the ventricle, so it is going to give rise to the smooth parts of the ventricles that are going to continue into the pulmonary trunk and the aorta, right? So this bulbus cordis is going to give rise to the smooth parts of the ventricles, right? This region, right, from where these outflow tracts are going to emerge. This truncus arteriosus is going to rise into the aorta and pulmonary trunk, right? So we have seen now that truncus arteriosus and bulbus cordis are going to form what structures, right? Now we will see this primitive ventricle. What is this primitive ventricle going to develop into? It is going to develop the trabeculated part of the left and the right ventricle. So we can see that we have divided the ventricles itself into ventricle, into smooth part, and a trabeculated part, right? In the similar way, we will also develop the atria. We will see when we go towards that. Now ventricle smooth part has been formed by the bulbus cordis, and the trabeculated part is going to be developed from the primitive ventricle, right? As we have seen here, the primitive ventricle and the bulbus cordis, these structures are going to develop the ventricles. One is going to develop into the smooth part, and the other one is going to develop into the trabeculated part, right? Also, we have seen the development of aorta and pulmonary trunk. Okay, now we are going to see how the atria develop from this structure, primitive atrium. Okay, so primitive atrium, as we can see, has developed into this sinus venosus and this structure right here, which we will still call it as primitive atrium or atrium simply. So sinus venosus and atrium, we have these two structures that will develop into the full right atrium and the left atrium. Now, as we divided this ventricle right here in the smooth part and the trabeculated part, we will also divide the atria into the smooth part and the trabeculated part. Okay, this is the division of our actual atria, the developed atria. We have the smooth part and the trabeculated part, right? Okay, how are these going to develop from these structures right here? First of all, we need to understand that this trabeculated part is going to be developed from this structure right here. We also call it as primitive atrium. Simply, the primitive atrium is going to develop into the trabeculated part of right atrium as well as the left atrium, right? Both atria, either it is right or the left one, the trabeculated part is going to be formed from the primitive atrium. Now the smooth part of these atria, smooth parts, how are they going to develop? This structure right here that we can see here, the sinus venosus, this sinus venosus has two horns, the right horn and the left horn, right? So the right horn of the sinus venosus is going to give rise to the smooth part of the right atrium, right? This right is horn of the sinus venosus is going to give rise to the right horn will give rise to the smooth part of right atrium. Okay, and the left horn is going to develop not into the smooth part of the left atrium, but it will develop into another structure. It is going to develop into coronary sinus. Coronary sinus we'll discuss when we will discuss the supply of the heart, and there we will see a structure called the coronary sinus. So this left atrium, the left horn of the sinus venosus is going to give rise to the coronary sinus, and right horn is going to give rise to the smooth part of the right atrium. All right, the question is that from where the smooth part of the left atrium is going to develop. That is going to develop from the primitive pulmonary vein. What is primitive pulmonary vein? So the development of the pulmonary veins is a different topic, and this we'll only see for the concept here, that structure that is contributing, embryological structure that is contributing this pulmonary vein is going to give some contribution to the left atrium. This is the smooth part of the left atrium, right? And this was the trabeculated part that we were talking about, and this was formed from the primitive atria, right? And the smooth part of the right atrium, that was formed from the right horn of the sinus venosus. Let's summarize the above discussion. We saw that truncus arteriosus, this was a part of the first part of the endocardial tube, or the primitive heart tube, as we discussed. This truncus arteriosus was giving rise to the aorta, the ascending aorta, and the pulmonary trunk, right? So we can see this color right here, then the purple has developed into these two structures, right? The second part was bulbous cordis, and it was contributing to this part, the part of the ventricles that is going to lead into these two outflow tracts, right? So this was the smooth part of the ventricles, either right and or left ventricle, both were going to be developed from this bulbous cordis, right? Okay, so the next one is this ventricle. So the trabeculated part was going to be developed from the primitive ventricle. The smooth part has already been formed here, and now this was the trabeculated part. Okay, and this was our primitive atria and the sinus venosus. The primitive atrium is going to give rise to the trabeculated part of the right and the left ventricle, both right and the left ventricle. This portion was developing into the right and left atrium, but trabeculated parts only, right? The smooth parts were going to the right atrium smooth part was going to be developed from this right horn of the sinus venosus, and the left atrium smooth part was going to be developed from this pulmonary vein, right? All this this was all about the development of the heart chambers, right? Now we will discuss how these chambers are going to further divide into the different the actual chambers, right? The left and the right atria, and the left and the right ventricle, the septation of these chambers. We will discuss this in the next part.